urban Indian population in enrolling the American Indian Alaska Native community. Our goals for this webinar are to highlight the successes and lessons learned from urban Indian assisters and navigators that are supported outreach and enrollment efforts during the initial open enrollment, while also providing participants information on the options available currently to American Indian Alaska Natives moving forward. For today's webinar, NCUI has brought together staff from 3 urban Indian health organizations, which are designated navigator sites, to present on their successful strategies to engage and enroll urban American Indian Alaska Native consumers into the healthcare marketplace. We hope that you will gain information that you will be able to take back to your own communities and implement. But before we bring on our special guest, first let's take a quick look at ACA outreach and enrollment current status and next steps in our first section to cover the current status of the marketplace. Although the first annual open enrollment is on March 31st, with a total of more than 8 million enrollments into marketplace health plans, there is still work to be done and that can be done for American Indian Alaska Native consumers. Other CMS health services, such as Medicaid and CHIP, are still open for enrollment year-round so that those children and adults that are eligible can obtain health care coverage. Although all states did not expand Medicaid, your state may be in negotiations to take part in the near future. So please continue to keep an eye out for those important legislative changes that could take effect. Also keep in mind that American Indian Alaska Natives are still able to enroll into marketplace plans monthly during special enrollment periods. Please continue to spread the word through your outreach efforts that the marketplace is still open and accessible for American Indian Alaska Natives. This process can still be accomplished through the online marketplace system and the designated call center. Lastly, American Indian Alaska Natives are eligible to receive an exemption from the tax penalty as long as they meet requirements of being a part of a federally recognized tribe or have been eligible to receive IHS services. It is important to note that the individual consumer must apply for this exemption in order for it to take effect. It is good for the individual's lifetime, so they will not need to reapply in future years. So just what is needed for the exemption verification? Let's take a look. As mentioned previously, there are 2 ways in which AIA and consumers can apply for the tribal exemption type. In order to verify eligibility for exemption, you will need to provide a documentation that you are a member of a federally recognized tribe or a letter from IHS that you have received services in the past or are eligible to receive services. IHS recently sent out an update patch for the RPMS package as noted here back in October 2013 in order for clinic staff to be able to download this letter through the patient's record. To be official, this letter must be signed by the CEO or other authorized personnel when presented for marketplace verification. If any UIHO is having difficulty with this process or needs to receive the patch again, please contact your IHS regional office or NCUI. So you may be wondering, what are the next steps for CACs or certified assistance counselors and navigators now that we are past the initial open enrollment period, beyond helping American Indian Alaska Native consumers enroll during the monthly special enrollment period? Let's take a look at some of the important post-enrollment assistance next steps for our CACs and navigators. Now that consumers have enrolled, it is important that assisters are available to help with utilization questions that may come up for the newly insured. This may be a consumer's first time navigating the system, so it will require new resources to guide them. Assisters should also be available for eligibility and coverage decisions that may need to be appealed through the marketplace. One of the main reasons a consumer may contact you as an assister is to help with the reporting of life changes to the marketplace. Once consumers have marketplace coverage, they must report certain life changes. There are several changes in the status that a consumer must report, including getting married or divorced, becoming eligible for Medicare or Medicaid, or gaining or losing a dependent. This information may change the coverage or savings a consumer is eligible for. Lastly, there are several other categories of change that may need to be reported, including if a correction to demographic information needs to be made. So how do you report these changes? You can report these changes in two ways. Online by logging into your account, or create an account if the consumer doesn't have one, selecting your application and selecting Report a Life Change from the menu on the left. You can also report these changes by phone by contacting the Marketplace call center. It is important to note that these changes should not be reported via mail. To conclude the areas for post-enrollment assistance, assisters will be involved in also helping to navigate redeterminations, continuing to educate consumers about the ACA, and lastly, strengthening community partnerships with local coalitions in order to increase visibility and effectiveness of the Navigator sites in the community. For more detailed information on what was discussed in this section, you can go to these websites for more resources. We would next like to switch gears and specifically hear details from some of those assisters that worked on the ground during open enrollment who can provide you with some of their lessons learned and next steps for outreach and enrollment. I would like to introduce the 3 Urban Indian Health Organization Navigator sites that have agreed to share today some of their successes, challenges, and lessons learned. We have with us navigators from the Gerald L. Ignace Indian Health Center in Milwaukee, the Urban Indian Center of Salt Lake City, and the American Indian Health and Family Services of Southeast Michigan. Each site will have 10 minutes to present, and questions will be taken following the completion of all of the presentations. Please feel free to continue posting your questions in the Q&A box at any time for responses throughout the webinar. So without further ado, I would like to introduce our first presenters, Mr. Nicholas Duke and Ms. Kim Mueller from the Gerald Ignace Health Center. Nick and Kim, are you there?
Yes, we are.
Yes.
Good afternoon.
And I'll be advancing your slides.
Okay, thank you.
Go ahead.
Hi, good afternoon. As she had stated, we are located in Milwaukee, Wisconsin. We are an urban Indian health center. We have 2 licensed navigators as well as 2 certified application counselors that we have working with all of the clients that need assistance with the Affordable Care Act. Our clinic does work with a majority of Native Americans. However, we do see all of the urban community here in Milwaukee.
Our mission is to improve the health, peace, and welfare of Milwaukee's urban Indian community.
So here in Milwaukee, we've done a big push to get the underserved population of the American Indians and Alaskan Natives who are uninsured to come in and meet with us to see what their options are through the Affordable Care Act and the marketplace. So we do a lot of outreach here in the Milwaukee area, and we have seen hundreds of throughout open enrollment and have had some successes as far as our outreach. We held multiple enrollment fairs here where we had all of the navigators and assisters all just in one area kind of waiting for the clients to come in. They were able to come without having to stick to an appointment. They were able to get their questions answered quickly and efficiently, and we were able to enroll a good majority of them in qualified health plans through the marketplace.
We currently, so far to date, we've served 138 Native families, 208 non-Native families, so total 346 families since open enrollment began. And that number goes up daily.
Yes. And we found it very successful to partner with the local agencies where we've received referrals from. Here in the Milwaukee area, there are quite a number of other American Indian community agencies that we're able to kind of partner up with and pair up with, and they're able to refer their clients to us for their Affordable Care Act needs. That has worked out really well for us as far as getting the word out there. We also created flyers and educational brochures for every event that we've had. We also have flyers that we send out to our community partners so that they have them available to their clients when they are referring them to us, so that they have some information about us and what we do here. Could we advance the slide?
For those who are wanting copies of our flyers, we would be happy to do that if you would just send us the contact information. We don't have a problem with that.
And I believe Chelsea at Nikui or Kim at Nikui would be able to facilitate that. I believe you all have contacts with them. If you did want a copy of some of our flyers and brochures, you could just go ahead and let them know at Nikui and they could pass it along to us. And we would be able to get that out to you. We did also use some of the information that Nikui has put out. Nikui has a few different pamphlets and flyers.
Yes, that we were able to adapt to our clinic here in Milwaukee. We do have some other examples of our successes here in Milwaukee. We had some of our elderly clients, we were able to educate them into the options available to them, and they did decide to enroll after we presented them the different options. I think some of our elderly clients were afraid to enter into the marketplace, and after we were able to give them information about it, they realized that it was definitely an awesome option for them to enroll into the marketplace.
Yes, one of our biggest lessons that we have learned throughout this whole process is to educate the public and the Native American population. What they hear about the Affordable Care Act through the news and through other things isn't necessarily always targeted at the American Indian population, so it is hard for them to understand exactly how it works for them and how exactly they would benefit from going into the marketplace and seeing the options available to them, especially if they already receive services from an IHS facility. They don't understand
that they still need insurance, that it is an awesome option for them to seek. It's services that are them.
So as well as our elderly clients, we've also had some younger clients who may have just stopped being under their parents' coverage, and one in particular client who had been without coverage for a few years since leaving coverage was able to enroll in the marketplace, and through the tax credits that he was given, was actually able to get his insurance at no cost to him out of pocket. And being Native American, he was given the cost-sharing reduction benefit, so he has no cost as far as deductibles or cost-sharing or really anything out of pocket.
We're having some technical difficulties. I'm not sure if everybody's having the technical difficulties. It says that there's a network connectivity problem.
Is that showing on your screen currently?
Yes.
Yes.
It may be your internet connection because it's not showing that on our screen.
Okay. We do apologize. If we can just give us a moment to get this back up.
You actually have just one more slide as your challenges. I can advance them if you are comfortable just talking about it.
Yes, that's. Some of the challenges that we've had.
One of the biggest ones that we had looked at was the Native Americans who were enrolled in a tribe that was based in Canada, and that is still something that we are working on. It's hard that there isn't a drop-down in the marketplace for that, so it is a little difficult.
Yes, that's definitely been one of our challenges in getting that particular client coverage.
We also have found, again, the education aspect. A lot of our clients just don't understand the terminology behind the things that are used in the marketplace. A lot of our clients don't know what a premium is, what a deductible is. This is the first time that they've ever been exposed to health coverage care and health care coverage. So that is something that we strive to do, is to educate all of our clients.
Yes, I think education is our number one lesson learned. We started out educating our clients, but we are definitely, that's our number one way to reach out to them, is just to let them know the options out there available to them. We've actually been able to reverse some of our, we had a client who had taken the exemption, and we were able to reverse that, and they were able to get insurance at actually no cost to them. And again, because they were Native American, they didn't have to pay anything, and they wouldn't have taken the exemption if they would have understood it to begin with. So that was a good feeling.
A lot of the clients really is just an education aspect. And then, of course, some of the other challenges that we face were the technical difficulties with the website that I'm sure all of you have encountered at some point.
Yeah, I mean, definitely that's been a challenge. But I think that concludes our portion.
Okay, thank you, Nick and Kim. I appreciate you sharing a lot of that helpful information with everyone that's on the call today. There are actually one more slide that talked about your next steps. that you will be doing a 3-day outreach fair for American Indian and Alaska Natives monthly, and then also that you will be targeting the uninsured through your clinic patient roster.
Oh, yes, that is something that is definitely underway. We are holding the monthly fairs for our Native American clients, and we're handing out flyers at all of our local partnerships. And we are definitely in the process of calling all of those clients that were not, that didn't have insurance, and they are coming in and we're getting them enrolled. We're definitely seeing a spike in our insurance.
Great. It sounds like you guys learned a lot through this process and have actually implemented a lot of strategies and tools that I'm sure people will take away and implement into their own programs. So thank you. So our next presenter is Ms. Victoria Migoli from the Urban Indian Center of Salt Lake City. Victoria, are you there? Tori, can you unmute yourself by pressing *6 or #6? And for the sake of time, I think we will skip to the next presenter, and we'll try to get Tori on the line in just a few moments. Just bear with me for 1 second. Jennifer, are you there? Hello, Jennifer, if you can unmute yourself.
Yep, I am here.
Okay, so our next presenter is actually going to be Ms. Jennifer Pipes from the American Indian and Family Services of Southeast Michigan. And I will turn it over to you, and I will advance your slides as you tell me.
Okay, thank you, Kim. Hi, my name is Jennifer. American Indian Health and Family Services is located in Detroit, Michigan. We have been assisting consumers with enrollments and referrals through other activities for over 6 years. We had one full-time navigator who also serves as the benefits coordinator. Our agency has 2 staff navigators who worked on a volunteer basis, along with certified application counselors who were answered questions and schedule or refer to the appropriate services. Michigan is a federally facilitated state, and AIHFS received the Navigator grant, so we could not just target AIAN. We had to open our population to everybody. Our outreach was to the Detroit metro area. Our agency covers a 7-county service area which surrounds the Detroit metropolitan area. None of the counties we serve had any designated tribal reservations. So on to our next slide. We have partnered with other clinics and organizations, local, state, and federal are included. People such as for Medicaid and Medicare services. We were down at the Detroit Auto Show, local hospitals, other federally qualified health centers, hospitals, churches, schools, and Enroll America played a very big part in our partners. So far, we have enrolled 477 consumers through the marketplace. These numbers only reflect actual enrollments. They do not include creations, one-on-one education, or plan comparisons. If we were to include those numbers, I think we've reached over 800 consumers. 102 enrollments in March alone, because that was obviously during the last month of open enrollment, and there was an increase in the number of consumers that were doing their late enrollments. Michigan had the only late state expansion for Medicaid. And that meant that the consumers could not actually enroll until April 1st. So in April, we had 307 Medicaid enrollments. So in that first month, from April 1st to the end of April, we were flooded with enrollments for the expansion, and we held several on-site enrollments. You can go to the next slide, please. Some of our challenges, a major one was consumer transportation to enroll. Being in the inner city and working across 7 counties, a lot of consumers lack transportation for in-person navigation assistance. During year 1, we were unable to do as many off-site events because of the outpouring of people who made appointments and the lack of additional staff to attend other events. Our other challenge was that we lacked funding for outreach to reservation-based communities. Michigan has 12 reservations, and we were unable to assist the tribes because we lacked the funding and staff to travel to the reservations. So many of the tribes have uninsured, uninformed AIAN communities that lack the help that they needed. Next slide, Kim. The things that we will continue in our next step, all of the staff that are trained and certified will continue to stay up to date with the trainings, guidelines, and laws throughout this special enrollment period. We will continue to build broader partnerships by working more closely with the tribal organizations and to help them understand the benefits that they may be entitled to. We will also provide education for federally recognized natives. We all know that there are several provisions which can lower cost as well as allow for exemptions and special monthly enrollment periods. So we want to continue to get the word out for that special enrollment period. We're also in the process of working on additional funding opportunities to continue our outreach and enrollment efforts that are geared more towards the American Indian Alaska Native population. We have several things really going forward. So then the next one. Some of the lessons that we learned is that we actually need more navigators to handle the amount of consumers that called in to get assistance. We had to turn clients away. We had to, send them to other CAC sites or navigation sites. We couldn't see all of the people, even with all of our volunteers. It was also essential to train them additional staff members as the certified application counselors so they could answer questions, therefore eliminating unnecessary appointments. We also learned that education is essential. Most consumers are not educated on insurance terms, things like deductibles, co-pays, co-insurance, so that education piece was essential. And our last lesson learned, know who your audience is and to that audience. So if you're speaking to a group of people who don't understand what deductibles and co-pays and co-insurances are, we would definitely advise that you explain yourself and educate yourself and know who you're talking to. And I think that is it for me.
Awesome. Thank you, Jennifer. I just want to check one last time to see if Tori was able to rejoin us. She had some difficulties. Tori, are you present on the line now?
Yes.
Okay, so let me go back.
I just had to call on a cell phone, so our whole building went down with internet and phone, so I can't see the slides, but I have mine in front of me.
Okay, So I will advance them for you, and you just let me know when to move forward.
Okay.
Right now, I am on your first slide set that talks about your facility.
Okay. All right. So yeah, this is Victoria with the Urban Indian Center in Salt Lake City, Utah. Our mission is to preserve the heritage, enhance the well-being, and strengthen the future of the people. We refer out to mostly outside resources. We do some things here in-house, and we have 3 navigators here. 2, myself and 1 other, are full-time in the office, and we just rotate days for navigator duties. And then we have 1 that's part-time, and he's fully dedicated to outreach. Next slide. Our successes have been mainly, a big thing for us has been getting out information to the American Indian, Alaska Native community just about what the ACA is, what health insurance is, what Medicaid and CHIP are, and then also the exemptions for the penalty for not having insurance. Explaining health insurance and the benefits of being covered is a big thing for our community, as many of them have never had health insurance and they don't even necessarily understand the full benefits of being covered and all the benefits that they can get through private insurance that we don't cover here, like emergency room services and specialty care and things of that sort. We have only enrolled a handful of people into the Affordable Care Act. One of those people came in seeking dental coverage, and when I told her she needed to get medical coverage to receive dental, she said she was willing to apply and see. So we went on and applied. This woman is in her 50s, and she has been self-employed for over 15 years. And once we went through the whole process on the healthcare.gov website, we came to find that she qualified for medical coverage for $2.85 per month, and that was very exciting to her to have health coverage for the first time in over 15 years. We also have created a pull-up banner that we use for outreach. It's pretty simple and straightforward. Next slide. The barriers and challenges that we have faced, the biggest one for us is that Utah has chosen not to expand Medicaid, and this is a really big barrier for our community as the majority of our clients fall below the 100% of the federal poverty line, but often too high for Medicaid or are single adults and don't qualify for Medicaid. So this is a big barrier for us. We do have a letter about expanding Medicaid that if our clients are willing to sign the letter, we're asking them to sign it, and then we are willing to mail that in for them to the appropriate congressperson to try and influence the expansion of Medicaid in Utah. So this has led to many of our clients needing the exemption due to the no Medicaid expansion, as they don't qualify for either, and without qualifying for the tax subsidies, it's quite costly, so they just choose to do the exemption so they don't have to pay a penalty for not having coverage. Another barrier and challenge for us has been that once the open enrollment had ended for the rest of the population, the advertisements on TV and radio and all of those types of things ended, so our traffic decreased greatly. As those advertisements also never talked about the ACA and the special circumstances for American Indians, Alaska Natives, and they never emphasized that they have open enrollment year-round. We had a lot of clients come in right before the 31st thinking that they needed to take care of it right then, and we tried to inform them all that they had the option to do it any time. We helped those who wanted to do it right then, but also tried to encourage them to come back later on, as towards the end we weren't able to get through everything with all the traffic. So yeah, this has just led to the American Indian population not knowing that they can still enroll. Another barrier for us has been that there hasn't been enough information on the pamphlets geared towards American Indians and Alaska Natives, or the information just hasn't been simple enough. It's just been kind of a lot and overwhelming, and I know at least for our community, for us, we need them to be more simple so people that have a lower education level are able to understand them and read them clearly and understand what the pamphlet is saying. Another barrier is that there's a lot of misperception about Medicaid. For example, mainly estate recovery. And estate recovery is that when Medicaid recovers an amount of money from the estate of a person who received Medicaid, who are 55 or older when they receive Medicaid benefits. And then the amount recovered is limited to the amount it's spent on the person's medical care, and Medicaid cannot do this if they are survived by a close relative, such as a spouse or child under 21, or it would cause hardship, and also for a few other reasons. But in the reservation, in the tribal, out in the tribes on the reservations, this is a big barrier, as many people don't want to apply for Medicaid due to this estate recovery, as they fear losing their property and such if they pass away. We haven't really found this to be an issue for the urban population. We want to work with the local tribes, and we've reached out, and we just haven't been able to work with them, as we've just had a hard time getting a date set and hearing back from them. So this has been a barrier for us. We have gone out to one tribe to present, and we've been trying to set up a date for a while to go back and do an open enrollment. Another barrier is just clients understanding basic insurance terms, such as premiums, deductibles, copays, coinsurance, and tax subsidies, as many of our community have never had health insurance and do not understand what these things mean. So we do spend quite a bit of time educating and explaining these terms so they can understand. Next slide. And for lessons learned, we learned pretty quickly in the beginning to ask questions regarding income when people first came in, and using the Medicaid and CHIP income limits table and the federal poverty guidelines for the ACA to determine which programs they're most eligible for and would qualify for. This helped us to eliminate spending time applying for something and then finding out that they didn't even qualify for the tax subsidy, so they weren't going to enroll into the marketplace anyway. So we use this now, just ask people questions and kind of filter out if they should apply for Medicaid or for the health marketplace, or if they fall into that coverage gap. We also have learned to ask clients to make an appointment to come back and apply online with myself or one of the other navigators, as often when they come in, they don't have all the information they need, especially for Medicaid online. And same with the marketplace, such as income and all that type of stuff. So we give them a list of items and information to bring back to complete the application, so that we don't have to start it, and then they're less likely to come back again to finish it. We also have learned to inform clients that they will need an active email, as many of our clients don't even have an email, or many of them have an email and they only know their username and have forgotten their password. So just encouraging them to check on that before they come back for their appointment to apply, so that we don't have to spend a lot of time trying to figure that out. And I think that's everything for me.
Yes, it was. Thank you so much for getting back on, Tori. We really appreciate it. Just bear with me a moment. I'm going to flip through to the end of the slides. I had a couple of slides that just overview. So before we close out, I would like to provide you with a brief takeaway of the lessons learned so far by our sisters and navigators in Indian country that presented today. Some of those lessons learned and best practices that I heard mentioned were that there is still a need for more education of AIAN consumers. The practice of collaborating with other organizations such as tribes, churches, or universities is vital to increase efficiency of outreach events. Thirdly, it may be helpful to recruit and use extra volunteers as assisters when outreaching, both in-house and at your facility and at events. Fourth, population of the American Indian Alaska Native community now fall into the expanded Medicaid population, which may limit marketplace plan enrollments. Also, to be effective during the special enrollment periods, there is a need for more advertisements so that the community is aware of that option. Also, a point that came up was that some of the more rural options that navigators may have to cover, more out-of-the-box thinking may have to take place to reach this population, especially when there's no Wi-Fi or internet available on the reservations or in just rural areas. And lastly, I wanted to mention that social media campaigns could help reach certain age targeted populations like young adults. So with that, I'd like to thank all of our presenters, coming from the Gerald Ignace Indian Health Center, Nick Duke and Kim Mueller, from the Urban Indian Center of Salt Lake City, Victoria Migley, and the American Indian Health and Family Services in Detroit, where Jennifer Pipes presented her lessons learned. Their contact information is all listed here if you would like to reach out to them individually. And again, my name is Kimberly Fowler. I am the TARC Director here at NCUI, and we appreciate your attendance on this webinar. At this point, I'd like to open it up to if there are any questions that people might have that they would like to ask any of our presenters or on any of the information that came through earlier. So we do have one question. It is from Emma Hall. She states that Cherokee Nation, I have a patient that is on Blue Cross Blue Shield of Oklahoma. She does not have any providers in network in the town where she goes to college. What should we do, and do we have to go back into the marketplace? At this point, any of the presenters can open their line to make a response. So I will answer that question for us. They can either, and if I understand the question correctly, and actually we have a response from one of our participants that says Oklahoma Blue Cross Blue Shield should have or should be on the BSBC choice policy for provider network. So I'm not sure if you need to go back in and read about the policy for the plan that that person enrolled in order to be sure that they have an in-network provider. I know that on the marketplace site, there's a tool that allows you to see who's in network or which providers are in network for the plan that you're trying to make a choice on. You should be able to go through that tool or widget, as it's called, on the website and see if their provider is actually on another plan that may be provided to them. Otherwise, that person would then maybe have to file for an exemption if they do not find a plan that's appropriate for them or that is within their household income. There's also a response that says the choice plan is the larger network. The other Blue Cross Blue Shield plan has only Hillcrest Healthcare System providers. So it sounds like there is another option for Blue Cross Blue Shield in the choice plan for the larger network. If that did not answer your question, feel free to write a response to that, and we'll try to give you more details or send that information to you after the webinar. Were there any other questions that came up throughout the webinar for any of our presenters? I see a couple people typing, so I will just wait. I'd also like to mention that this webinar has been recorded or is being recorded and will be archived on the NCUE website, as well as sent out to all participants on the webinar. We have a question that is asking, is unemployment considered income? Beverly, do you have a response to that?
Okay, can you repeat that question? I'm sorry.
No problem. Is unemployment considered income?
That's I'm not really sure about the answer to that question because that would be an IRS question. I think it is considered income, though.
Yes, I believe so.
We do.
Hey, this is Jennifer. Unemployment is considered income.
Thank you. So there's another comment that says, I heard through the grapevine that enrolled American Indian Alaska Natives that were eligible for 0 premiums and didn't sign up might get denied services by IHS. Any thoughts? I have not heard that thought, nor do I think it's true. I don't think that whether you enroll or not through the marketplace has any pressing value on if you can receive IHS services, which is a completely separate system.
I agree.
Yeah, this is
IHS
Victoria.
services are always available. This is Beverly. Sorry.
Thank you.
Go ahead, Gloria.
This is Victoria in Salt Lake. That's definitely not true. Maybe what you heard is, I know there's been a push maybe for some centers encouraging their community to get coverage through the marketplace so that that funding can, instead they're not using the funding from the IHS facility and can go to other people, but that's by no means doesn't mean if they choose not to, they can't get services through an IHS facility.
Okay, we're almost at the top of the hour. If there are any other last pressing questions, please feel free to go ahead and type those in. So while we're waiting, I'd just like to also mention that we will be sending out a short evaluation on this webinar. And we ask that you please fill out that survey so that we can think about new topics for the future, as well as correct any issues that may have been held during the webinar that you would like for us to attend to. We really appreciate your responses to those webinars, and they really help in moving us forward and providing training and TA to our community. The survey link is actually in the discussion pod if you would like to go ahead and click on that. You also will be receiving it by email. Okay, so at this point, I once again also like to thank Beverly and Juliet for being behind the scenes and answering any questions. I appreciate all of the assistance that you helped provide to the participants on this webinar. And I'd also like to thank our presenters, our navigator sites in urban Indian health community. So at this point, I really would like to say thank you to all of our participants that joined in, and look forward to seeing and hearing from you in the future on future